Hello, ladies and gentlemen. Welcome to Insurance Master Seminars. I am Dr. NIK NIKAM. I've been a cardiologist for 40 years dealing with Medicare patients. Today we are going to be talking about Medicare. Particularly, we're going to be talking about Medicare prescription plans. This is brought to you by Health Life 360, located in Houston, for the past 25 years, dealing with insurances of all kinds. In the previous presentations, I talked about Medicare Basics ABCD for 2022. We have a separate video on Medicare supplemental plans, their costs, and we have a separate video on Medicare Advantage plans. In this presentation, we are going to focus on Medicare prescription drug plans and question answers. So let us begin with the feature presentation. When you become eligible for Medicare, you are going to receive a card which has Part A. If you enroll in Part B, then your card may also show Part B on the card, and here is your Medicare number. I would suggest you make a photocopy of this and keep it in your photo album just in case you lose your Medicare card, so that when you go to see a doctor or to get a test, you have your insurance information on hand. The next thing I would like to talk to you about is the two different routes through which you can get your complete Medicare insurance package. One is the traditional Medicare, which involves Part A, Part B, and Medigap, Medicare supplemental program. I have separate videos on all these topics, and that is the traditional Medicare. And today we're going to focus on Part D prescription plan, which is a separate plan altogether compared with the other ones. On the other hand, we have a Medicare Advantage plan, which is Part C, which combines Medicare Part A, Part B, and Part D, along with some additional features like gym membership, vision, hearing, and others. But anyway, we're going to be focusing today on prescription drug plan. Medicare Part A, which was covered, Part B, which was covered in the previous video. Take a look at this. And before we go any further, I would like you to download this PDF file from the CMS website. Just Google Medicare and You 2022. This is almost a 100-page PDF manual on complete details about all that you need to know about Medicare, Medicare Advantage plans, dual plans, and many other features, including Medicare Advantage plans. So let us move on to the main topic for today, and that is the traditional Medicare, where you have Medicare Part A, which is given to you automatically. Part B is something you need to enroll in the program, and I have a separate video on that because you have a certain time limit during which you have to enroll in Medicare Part B. And of course, Medigap is a supplemental insurance which covers the deductibles and copays, and Part D is the separate drug prescription plan which covers medications. Let's talk about prescription plans. As I said, it's a separate plan altogether. You have to get a separate plan which will cover your drugs, medications, and vaccinations. They are divided into various regions based on the state, and anywhere in Texas, that's where I'm from, the prescription drug plans would have similar features. Let's talk about what does it cost in 2022 to have a prescription plan. First of all, you have to pay a monthly premium, which can vary anywhere from $10 to almost $100 per month, depending upon the plan you choose. Then we have the deductible. That means the first $480 is something you have to pay. Then the initial coverage lasts from $0 to $4,430, during which time you pay co-insurance and co-pays. The co-pays could be for each medication, per each prescription filled. Between $4,430 and $7,050, you have what is called the donut hole or the coverage gap, during which time you will be paying 25% of the drug cost. I want to emphasize one fact about drug costs. When we are talking about drug costs, they are not talking about the discount price you get at the pharmacy using all the coupons and discount costs from the manufacturers. They are talking about the retail cost of the drug, and that's where your $4,430 is reached very quickly, even though you think you are paying only $5 copay or $10 copay. And that's why when you drop a prescription plan, you need to look at the retail cost of each one of these drugs. And I'm going to walk you through an example of how to look at the retail cost of a given drug. Then beyond $7,050, we have what is known as the catastrophic coverage, at which time the Medicare, the prescription plan covers the drug, and you pay only 5% of the cost of that particular drug. Okay, that's as far as the finances are concerned with regard to the prescription plans. Let's look at there's another thing that we need to be familiar with, that is the so-called tiers. We have tier 1 drugs, tier 2 generics, tier 3 preferred brands, tier 4 non-preferred drugs, and tier 5 specialty drugs like cancer drugs or chemotherapy drugs or drugs used for chronic illnesses, for immunosuppressants or Alzheimer's, things like that. Anyway, most of the time your tier 1 drugs and tier 2 drugs may cost you $0 in terms of copay, but please keep in mind, anytime you're getting a drug, whether you paid $0 or $5, the retail cost of the drug is calculated as the total cost to find out when you reach that $4,450 limit, after which it goes into the donut hole. So again, as you go more and more brand names, the cost goes substantially, and this can add up to, especially if you are in the donut hole where you're paying 25%. Some of the drugs could be costing like $1,200 a year. I had one drug which costed like $2,400 for just one drug, and some of the cancer drugs could be costing $5,000 to $10,000. And when you talk about 25% of that drug, it can add up quite significantly in a short time. So keep in mind. And in 2001, they came up with a moratorium on insulin so that your insulin cost will be less than $229 no matter what kind of insulin you get, and which is one of the best things that was done in 2021. So your maximum cost deductible is $35, initial coverage is $35, maximum is $35, and catastrophic coverage is $35 or less. Keeping that in mind, here are some sample premiums depending upon the prescription company. WellCare, Mutual, Cigna, Humana, and ARP, Aetna, all these things, as you can see, it ranges anywhere from $15 to $85 and all these different features. When we are talking about drugs, not only are we looking at drugs, preferred drugs, we also need to be thinking about whether you can get these drugs locally in your local pharmacy rather than waiting for it to be coming in the mail and spending 2 weeks or maybe more waiting for the drugs. And also the quantity limits. Are they going to give you the medications for 90 days, or do you have to make a trip to the pharmacy and stand in line there for an hour every month? Then this what's known as the step therapy. If your doctor's order, for example, a tier 3 preferred brand, then you may be required to try more preferred generic drugs before the pharmacy approves the tiered drug. Even when they approve, remember, your cost is going to be substantially higher. There are certain pharmacies which give you discount, and Kroger is also having its own discount. So is HEB and other major pharmacies. I would say shop around. Even though you think you are getting the best deal from one particular plan or a drugstore, shop around. The best place is to go to GoodRx and put the name of your drug and see what are the different prices from Kroger, from CVS, from Walmart, Walgreens, and various local pharmacies. Wherever you get the best price, that's where you should be shopping. So keep these things in mind, because sometimes the drug costs can be phenomenal and you may get substantial discounts, especially if they are of a generic nature, through these discount free outlets. Okay, now let us switch gears and look at how we find out about prescription plans. Okay, this is the Medicare website. You go to medicare.gov and click on the main page. When you get here, continue to log in without signing. And when you come here, you see a list of options, and we are interested in drug plans, prescription drug plans. And that's what we want. You can put your zip code. Mine is 77478. It hasn't changed in many years. We put that one, and then just say, I am not sure about whatever the history is. Continue without logging in. Do you want to add drugs? Yes, let's add drugs. Let's go on to create some drugs. Let's add some blood pressure medicines like losartan. Let's say we add this drug, 100 milligrams. I'll go for 90 days. Every 3 months, add the drug. Let's add another drug here. Well, correct. Add this drug. Tell them it has the lower cost generic. I said no, add brand name instead. And we'll make it 90 days and every 3 months. And what I will do is I'll put the same drug, correct. And I'll bring up here and I'll add a generic one. Add generic one. So 20 milligram capsule, extended release 30. Okay, let's go to 90 here so that we compare apples to apples. Add the drugs. So we have a 90 tablets, 3 drugs, and one is for comparison purpose. So we don't want to add any more drugs, and continue with that. And we don't need to find pharmacy. We already have a mail order pharmacy. Then let's select Kroger, and let's select one more drug company, which is Walmart is fine. So we can compare these drugs and click done here at the right bottom corner of the screen. Now here you see some of the things that I want to highlight. It says WellCare value prescription came at the top. The monthly premium is $12.90. The total cost is $5,893.84. That is the retail pharmacy estimated total drug cost plus your premiums. Remember that we're going to look at that in detail, and that is what is going to be. And you have a $480 deductible. Humana is the same thing. Okay, so we got this one. So what we are going to do is we are going to compare this. We're going to look at one of these plans and look at the details of this particular plan. So when we come to the details of this plan, remember now the retail cost, you're already like beyond your $4,450 limit. So you're already in the donut hole. But your premium is this one, and monthly premium is this much. Your deductible is $480. And let's keep coming down. That's good. Your Kroger is a preferred pharmacy, and so is a mail order, and Walmart is not in the network. But look at the cost I want you to see. The cost of carvedilol, which is a generic one, is $1,204. And the brand name carvedilol is $4,560. That's why I say it pays to shop around. You ask your doctors to get you a generic wherever possible, because otherwise the cost could be astronomical compared to a generic one. Even then, this extended release is infinitely more expensive. If I had put a short-acting medicine which you can take twice a day, the cost would probably be close to like zero. I know that because I have run this example for presentations before. So that's where your cost is going to be. And if you come down here, you will find out how much it's going to cost you each time you fill a prescription. $1,600, $1,300, $1,377, $1,377. Then when you open up this, for example, Kroger, and you will see how much it's going to cost at Kroger. cost before, cost during after deductible is $1,300, and during donor toll your cost is $1,200. After the donor toll is $1,174. So that's it says monthly, but it's quarterly. And you can look at the same way with the mail order prescription, and you can see they are very much similar. So how do we cut the drug costs in these situations? First of all, try to get a generic equivalent. If it works, there's no reason to get a brand name and pay $1,000 every 3 months for one prescription. You're just talking about one prescription, and if you add up multiple prescriptions, it can be substantial. One of the prescriptions I ran was well over $12,000 per year. That is with all the discount prices and with insurance. So this is no simple matter. You really need to shop around. You need to be an educated consumer, and you need to talk to your doctors and see if you can get a generic drug, which will probably cost you zero copay if it's tier 1 or tier 2, and you can substantially, like if you were to get a generic carvedilol, let's take out these two medications, your cost would be practically $20 to $40 per quarter. How about that compared to $1,300 per quarter? So ladies and gentlemen, this is a very quick overview of Medicare prescription drugs. There's a lot of information that you need to know in order to see what is the best plan for you. That's where we come into the picture to help you with making the right choices based upon your medical history, based upon the drugs you are on, based upon which pharmacy has the best price, based upon whether you can get those medications locally, and how you can keep your cost down. So give us a call. We will help you craft out your prescription plan the best way. It will, one, save you money. Number two, it will help you to get your drugs at your local drugstores, and hopefully that will keep you healthy. Please do watch our other videos on Medicare Master Seminars, and we will see you in the next video.